My name is Jennifer Hodder. I am a critical care nurse for almost 20 years now, and I am currently working on my master's in the Faculty of Graduate Studies, I guess in the School of Nursing. My research is born out actually of my time as a critical care nurse, specifically a critical care trauma nurse. I'm looking at gun violence and critical care trauma nurses' perceptions of gun violence, and what their lived experiences are caring for individuals with gunshot injuries. And so people look at me and sort of question, why would nurses care about gun violence? And of course, being somebody that works with patients and families that are affected by this, my question, I guess, would be, how could we not care about gun violence? This is something that is progressively, getting worse in Toronto society. And if there's something that we can do in our relationships with patients and families that can make it better, why wouldn't we take advantage of that opportunity? This actually came out of an experience I had at the bedside. It was my very first semester doing my master's, and I had to find a nursing phenomenon to write a paper on. And I didn't want to focus on sort of the things that I've heard about most in the research, which is hand washing and, various types of pneumonia. And so I went into work and I had a patient in the bed that had been shot several times for his cell phone. And I was talking with his family, and I could just see the heartbreak in the family's eyes. I could barely make a connection with the patient. They were so emotionally flat. And I thought, this is something I should care about, but there was no information on it. And so I looked into it, and nurses care passionately about this topic. Talking to nurses, as well as talking to people in the community about their experiences. While their experiences are horrible and hard to be relived, the people that I have talked to are so passionate about this and have been so willing to be vulnerable and willing to share their experiences to improve the lives of others and themselves. So right now I'm currently working on my master's thesis. I've conducted a qualitative study where I've gone to and interviewed both nurses and professionals in the community. And I'm currently in the middle of conducting my analysis so I can write up my thesis and graduate. I'm hoping that it'll be the beginning of a discussion. It'll be a beginning of a discussion for nurses about gun violence, how they think about gun violence, how they think about individuals that have been shot. I'm hoping that my research will continue on. And maybe I'll go and start my PhD. But it's a stepping stone. It's the beginning of a conversation. And so if that can help nurses, patients, families, I think that's amazing.